Thank you for inviting us. I would like to especially thank Action for Healthy Community for making this, I will say, even interview. And the most important things I would like to say, mental health is a reality. We need to talk, we need to come together and see what we can do. Thank you very much.
I would like to say thank you to everyone who was involved to make this conversation fruitful and to share our own experiences and learn. So, and then second thing, I would say mental health is not about other people, it can be anyone. So what I expect is everyone can put energy together to work for a better, vibrant and dynamic community. Thank you.
So I want to thank everybody for this rich conversation. In this conversation, I learned how COVID impacts our mental health, and our well-being. Thank you.
So I would like to say thank you for the opportunity that have been given today. And what I took away from this conversation is that the COVID virus and the last year has a huge impact on the families and the communities' mental health situation. And what I learned today will help me share with my community and try to invite people to be more open about the mental health situation. Thank you.
Well, welcome to Alberta Healthy Communities, ladies and gents. We're very happy to have you here. We're here to discuss mental health and try to make it more like a talking point, and hopefully that people can talk more about and generate some more conversation from there. So welcome. I would like to start with you, Aja. Please introduce yourself and tell us a little bit more about you.
My name is Abo Aja. I am the Secretary General of our community, Ivorian community. So I came in Canada 8 years ago. And yeah,
that's awesome. What about you, Salman?
Yeah, my name is Salaman Yameugo. I'm originally from Burkina Faso, but actually I was born in Ivory Coast, so I'm kind of like both sides, and I'm from Canada to Canadian.
Yeah.
And you know, that's so great. So, and I have been in Canada for 8 years now. Wow. And then I got this opportunity to come to share and to learn and to give back, like Kazie said. Mm-hmm. And I'm happy to be here.
Thank you. What about you, Day? Tell
Hi.
us a little about you.
Yeah, first of all, thank you for inviting us to give us the chance to express ourselves and learn from you as well. So, as you said, my name is Day, and my full name is Jai Day Milen. I'm the president of the Ivorian community in Edmonton. And what else can I say about myself? I'm a health service worker, I'm a nurse assistant, and yeah, I recently became the president of my community, and I'm trying to work the best for my community, and I hope I will learn from you, and going from here, I will have something to share with them about mental health.
That's awesome.
Yeah.
I think we all have something to learn from each other,
right?
Yeah.
Yeah.
Well, welcome. And what about you, Kazia?
Okay, Kazi Koulibaly, my name. I have been here in Canada for 6 years now, from Côte d'Ivoire, Ivory Coast in English, and I am the former community leader of Ivorian community. Mm-hmm. And also I'm here just because, as I said in the beginning, I want to give something back, because it's not asking, it's also give something back. Mm-hmm. I'm working as an economic development manager, so I'm here and see what we're gonna do together. Yeah.
Nice. Thank you. And I am Gigi. By profession, I'm a social worker, almost 12 years there with mental health and aggressively helping the community in culturally missing points, especially mental health. So I'm here to help Shweta and everyone to make this conversation meaningful. And I have some teaching background as well, so we will learn together, as Shweta said, together. Thank you.
Thank you.
So I'll introduce myself too. I'm Shweta, and I've been in the mental health field for over 16 years now, and started as a nurse and then developed my skill as a counselor. So this topic is about talking more about mental health and wellness and COVID in general, right? So how about we start talking a bit about health and wellness? Like, what's your guys' idea about health and wellness in general?
Okay, so my idea about health and wellness. The first thing that comes to my mind about health and wellness is the environment. The environment you live in that has an impact on you, and the people you surround yourself with, and how you take care of yourself as a person. So yeah, those interaction has a very important impact on our health and our mental too. So yeah, that's what I thought about.
Yeah,
so.
I totally agree with you today that our environment definitely has an impact on us, and our surrounding is very important, right? What about you, Kazia?
Yeah, I will just say like the state of well-being. So what we need to fulfill our daily life, and what we can do to be more productive. So this is how I can define that as the state of well-being.
Yeah. What about you, Sam?
Yes, thank you for that great question. I would say that health and wellness to me is referred to the state of feeling that we have, and is, I would say, start by the state of feeling about myself first, and then the people around me. So that's how I see it, and then I would say it's involve self-responsibility to take care of yourself. But of course, there are people who cannot take care of themselves because different reasons. So, but I would say individually, wellness and well-being involve our own responsibility to act, to take care of ourselves.
Yeah, you guys make really good comments there. What about you, Aja?
For me, wellness is physical and mental well-being, and health. Health is the state of being healthy, and yeah.
Yeah, I think you guys, like, whenever you put what you guys said, all four, that's right? And everybody see health and wellness in an individual way, but overall it's a state of wellness. Right? Whenever you kind of think about, let's just kind of move over to mental health, what are some challenges that you guys have seen in your communities?
Basically, I think the first thing we need to know is about COVID, the impact of COVID, not only in our community, but in the society.
Right.
And what I can say is a kind of fact I realized our kids have been really impacted by the situation. So that time we need to find like the right way to see how we can support our children face on that situation. In the meantime, it was also a kind of challenge for us. Yeah. And for me, I am a man, I am an ongoing man. You know what I mean? Open-minded. I love to be being among people, enjoy life. And now everything was a little bit like stuck, and we can do anything. You have your children at home, they're crying because they want to go outside.
Yes.
And it's really complicated for us, difficult. But step by step, we're trying to figure that with some kind of strategy. Probably we'll talk about it later.
Yes. Yeah, you're right. COVID's kind of made our world smaller, right?
Yeah.
And like you said, and whenever we kind of live in such a small world, like it's hard. You need to take a deep breath sometime, right? And right now we don't kind of have this space with COVID. What about you, Dave?
Yeah, on the community level, I will say it will be the impact that we saw is the interaction with people, because as a community we have a certain way of living, of interacting with families, friendship and all of that. COVID had a very big impact on that, because all of those activities or the habits that those families had couldn't be expressed, like visitation or something simple as visiting a family for a birthday or something like that was really impossible to do. So that had an impact on the way the community expressed herself in the interaction. And of course, on the family level, as Kazit said, it was very difficult for the family to contain the children emotionally, and with the tabs and all the technology around now. Some families manage with that, but we never know. We don't know yet what the COVID will have as an impact on our children's mental health as well. But for adults, I would say, people try to cope, talking on the phone and making video calls, as I would say. But yeah, for people that were before COVID sick mentally, it will be something, the impact of COVID will be worse. But I think COVID will create more disease, mental health disease, for those that couldn't cope with the, how can I say that? Maybe someone will help me with this word, with the isolation.
Yes.
The impact of the isolation on the mental health. So yeah, that's a bit what I can share about the impact on the community.
Yeah, you're right. Like whenever you kind of think we are human beings who were used to doing so many different things that were fun and they are de-stresses for us, and then now we're limited to our very small world, whether that's home and work, and nobody is getting those de-stressing time, right? So that's going to impact on us very differently. I totally agree with you guys. What about you, Salman?
But this question by itself is kind of like a big topic, right? So there's so many things to say about it. But let's I would say three things. First, I think we already mentioned here is the disruption of the social network. Suddenly we had the COVID, and then I know in Alberta we got kind of like a chance to go out, but in some countries were more strict. But talking about in Alberta, we had to stay home with families, as my colleagues already mentioned here, and then it's really challenging. And then it depends where you live. So we have that stress. And I would say, secondly, is the financial stress, because a lot of people lost their job, and then they have to, bills still coming, right? So you have to face that, find ways, and then it was really challenging. And number three, that was the impact of like the family, you know, most of, I would say me, you're here, but you still have family back home, right?
Yes.
And sometimes that responsibility will not cease. People will still ask you to help them, then you get more pressure on you. So yeah, that's what I would say, in terms of impact.
Yeah, it adds to more challenges, right?
Yeah.
And even though you don't see it, it exists.
Yeah.
Right? It's same like mental health. We don't actually see it, but it exists, right?
Yes, yeah.
Yeah. What about you, Aja?
Oh, they already, said a lot about it. What I can say is also the COVID impact our health, like physical health. So by confining at home, in the pandemic time, people were not able to go, for example, for exercising. All the clubs are closed. So it impacts our health, like weight gaining, mental health, depression.
Yes.
So it break our connectiveness with others. So yeah, it impacts our mental health and physical health too.
Yeah.
Yes,
Yeah.
this is COVID, of course, as you guys all explained, this not only the COVID, it's COVID, it's actually kind of triggering the mental health issues in the community, which is not really addressed properly. As not only in your community, many community those completely depends on culturally, they lacks all kind of connections between.
Yeah.
So, and even in many communities, actually, we are not trying to disclose our issues to the neighbor or the people from the same community. I don't know much about your community, how good you are to say about mental health, discussion in your family, friends, along with you.
It's
Is it
basically
Yeah.
the same.
Yeah.
And we tend to keep
It is a
things
stigma.
private.
you see, that's the thing. That's make
Yes.
trigger the issues, and that's really hard.
Yeah.
That's one of the reasons we try to bring our concerns of mental health here. With it's a kind of common discussion we need to bring forward. Though government provide lots of supports, but the support is there, system is working, whether we are the part of that system or not. So that's the big question.
Like, I love what we are talking about here. We kind of moved along to talk about isolation, the fear of what other people will think of us if we don't talk about it, right? Like, what have you kind of experienced, like, with the openness of talking about mental health and in general?
In general, we don't talk about mental health. Usually we talk about like general problem. He said, I have a problem, I'm thinking about this one, I don't know how I'm going to figure out this issue. And today, you can say that, but someone can talk about that. But if he keeps talking about that after 1 week, something's going on. You see? So in our culture, first of all, we come in from a collectivist culture. So something belongs to me, belongs to her, belongs to everyone here. Something belongs to you, belongs to me too.
Yeah.
So, and now when you have a kind of issue, it's also my problem. We need to work on it. But at the same time, we have a word usually in our community, we don't use to talk about that. The word mental, when you say something has a kind of mental issue,
It's challenging.
oh my God, yeah.
I know. I can imagine what you're trying to say.
So we need to find another way to understand what's going on and see how we can support him, because this is what we're supposed to do.
Right.
But with COVID, it wasn't easy because you cannot go to meet your friend and talk about it. So talking all the time on the phone, now there's another issue. You get headache. Because always on the phone. So this kind of stuff, this is what I can say about it.
Right. You were going to say something there, Aja.
Yeah, in our community, mental health issue is a stigma. Like
It's a taboo.
Stigma. Yeah. And imagine you going to your friend talking about your mental health, your depression, and everything. They think that you are crazy. They just, who want to talk or have relationship with somebody that's crazy. And that's why people don't talk about their mental health to their friend even. And usually we seek for outside help with the mental illness that we have.
Okay.
Like we seek for help with a counselor.
Okay.
We seek for help with our leader, spiritual leader.
More spiritual.
Spiritual, yeah.
So the first person to go to is usually the spiritual leader.
Yeah.
And then maybe outside help as in a counselor then after that.
Yes, and I wanted to add something. Are you done? I wanted to add something to that. Culturally, mental health is a taboo in our society. So even though some people may be aware that they are facing something mentally, they are not going to share it with family members or with friends because they are afraid of the information to be spread around. Oh, this person is getting cuckoo, this person is getting sick. And you don't want to be isolated, but people are talking around you. You may not know, but when you come to the conversation, people are saying, oh, you start feeling that people are acting like, okay. They are not interacting in the truthful and serious manner with you. They are just letting you go talking because the rumor has already spread. So people are afraid of that. So sometimes when people face or they know that they are facing some mental challenges, if the person is still in the right mind, they can go seek for maybe a spiritual counselor. That's where we go most likely, because there it's free too, because we have to talk about the impact and the accessibility of the psychiatric psychiatric care and everything, which is not it's very expensive. Not everyone has access to it. So it's more likely we are going to look for the spiritual way and keep it quiet for ourselves. Privacy. Yeah. Even your children, you are not going to disclose that with your children. Most of the time, your family, your friend, you are not going to disclose that because you are afraid to be judged, right? Yes. Yeah, that's most likely.
That is a very common theme that we've been hearing, is that people are really worried about the fear of being judged. What's your thought about that, Salman?
I think is beside what has been said, and then you pointed out something very interesting, the fear of judgment. What I would say is sometimes is, I think Gigi, right? You mentioned that, yes, there are help available. But sometimes why do people don't go to seek for help, like in communities? And I would say sometimes it's lack of knowledge, because first of all, they might not know that there are organizations where they can go to seek help and to be better. So, and then the second thing is the fear of because if I go there and I share my information, what would the government or official would judge me? So sometimes most of us, we might not be Canadian citizen yet, or we're just immigrant. You know, we are kind of like, oh, you know what? I prefer to just go to talk to Kazir or to my leader instead of going to seek for help somewhere. And then that's a real challenge, because there is kind of like that trust.
So do you think that maybe that people fear that maybe they might not get their, Canadian citizenship or PR card if ever they were to go to somewhere?
No, I wouldn't say that, but the fact is sometimes we don't, you go to see a doctor. Yes. Then I think recently we have been talking about like racism or something like that. Then you will be judged right away. And then the way they're going to take care of you will be completely different from someone else. Yes. For this, sometimes it might be that reason, or maybe many more other reasons. But when someone is afraid to go outside to seek for help, and I would say many immigrants that I know, they have that fear. That, okay, if I go there and I share my information, maybe the government might get my information, and someday they might say, oh, you know what, there is something wrong with you. And other thing is, when you have children, the other fear is, you go there and you start to say, oh, you know what, mentally I'm not feeling well. And what we hear here is, oh, if you cannot take care of your children, then the government will take away your kids. Yes. Who is going to go out, a mother or a father, because and then have the government come and take the kid.
Yes.
Sometimes we prefer to bear it, to
Right.
suffer alone, and then not to disclose it.
Right.
Yes.
Yeah.
Yes.
Yeah.
Yes, as Solomon said about this, this is one of the common issues of the many community, not
Yeah.
only this community, because you know the people, those who immigrate over here after 3 years, they probably need to get their own citizenship. But and next one is employment issues. They think about if I disclose something, whether they refuse to get into a kind of employment, and is this affect our next generation to taking care of what do you think about others. So it's a part of stigma and taboo comes around. It's pretty much not only in this community, it's immigrant community has pretty much same kind of thing which I dealt with. Yeah.
And then I wanted to add something like personal, and I think all of us might have experienced that. When you go to meet with a doctor, it might not even be related to mental health, but they will start to ask you, oh, did your grandfather suffer from this? Did your father suffer from this? Your parent or something like that? Sometimes I will say, I didn't even meet my grandfather. I don't know.
Okay, yeah. So that means you are not comfortable with to listen those kind of questions or answer those kind of questions.
I think he's asking like me. Someone, I left my home country like 10 years ago, more than 10 years. I went to Europe and I came to Canada. If I didn't even know my grandfather, and then you know, the way I grew up, if someone were to ask me, did your grandfather die from heart attack? I don't know.
Right.
What I know, he's dead.
Period.
But what the causes, I don't know.
Yeah.
So then there are so many other questions.
Yeah.
And when you start to answer the question, you feel like, oh, are they spying on me?
Oh, okay.
So,
yeah, understood what you are trying to say.
and then we never know, right?
Yeah.
They must ask that question to your children too.
Yeah, but sorry to interrupt you, but I wanted to say something. I'm going to say something in French, maybe you will help me to translate it in English. But il y a des maladies héréditaires. Comment vous dites ça en français, en anglais?
Yes, and so what you just said, exactly, that's exactly what I was going to say. So what happened is
that's what they are trying to trace.
Medical professionals, the reason they ask us about our family history is because sometimes those get passed down through genetics. So then if they kind of have an idea you know, of what they're dealing with, it's easier to narrow it down that this is most likely of what it could be. So those are the reasons why they usually ask these things. Yeah. I love that we are having this conversation because you know it's important because what you just said, a lot of people think like that, right? Why is this question is being asked and we don't really know the answer? Sometimes we are even afraid to ask, right?
This is why it's important for the doctors to learn more about the culture. Yeah, because as he said, in our culture, we don't have a kind of diagnostic of the death of our grandparents like here. So when you ask us, for us it's weird. You ask that question. Yeah, you look weird because you can't answer that question. So why for you is right.
Yes.
So you know this is a kind of clash, a culture clash.
Do you think that maybe, I'm just trying to learn from you guys here, so maybe do you think if something was like to say, well, maybe you don't know this information, but I have to ask so I can better understand of your condition, do you think that would help at all?
Yes, definitely. That will help the person understand the why behind your question. He wouldn't think anymore about you spying on him, right? He will be understanding that you are trying to make a diagnostic on what is going on with him, right? So definitely that will help the patient, maybe a non-Canadian patient, understand why you are asking the questions, right? That will make him understand the purpose. Yeah.
Great. What do you think, Asha?
Yeah, definitely. Also, we can also learn about what is the process of doctors. It's both ways. We can learn and they can teach us how they process, what is the method of diagnostics, so that we can know this is why they ask this question. This is the reason of this question. So I think it's
So we've kind of talked a little bit about health and mental health, really. You know, like you were saying earlier, that mental health is such a taboo that maybe we can't even bring that word on the table. What if we kind of switched it around and kind of talked about wellness? What do you guys think about that?
Oh, wellness in what sense?
Like wellness in general, like how you're doing, like just opening that conversation.
Okay, so maybe I'm trying to plant a decor, as we say. Maybe you are going to visit your physician and your physician is asking you about your wellness and all of that. But me, if I'm going to visit my physician and he's asking me, how are you doing? What about your wellness? I will say, I'm not well, that's why I'm here.
Yeah.
I'm not feeling well, that's why I'm visiting you, right? Yeah, but maybe you should, I don't know. I don't know what the approach would be.
Yeah, because it's like, how do you make this a bit more easy to the community that, you know what, there's one saying that I kind of came across a long time ago, which is basically there's no health without mental health, right? And that is just so true. There's no health without mental health. You know, our physical body, when get affected, our mental health get affected. When our mental health get affected, sometimes we get physical symptoms as well, right?
Yeah, definitely.
So how do we recognize that then in the community, do you think?
Okay, I think I can answer that question. You know, I think I said that before, and someone will face a kind of challenge, like it's good today, but at the same time, when you are talking, you get mad suddenly, and after everything is good for him, and later he gets mad again.
Oh, mood switch.
Mood swings.
Yeah, mood switch, and those kind of signs. So you know something going on.
Sometimes it's very basic level, right? It can be your sleep being affected. It can be maybe your eating habit changes, right? So it can be very basic level as well. So with, you know, in terms of practices with well-being, what does each community do? Because I know there's 2 different communities here, right?
I will say yes, but it's just one thing.
Yeah. Usually we have the same way to live, the same culture. So, and
basically.
So, I said before we are a collectivist country. We're from there, and usually when we have a good news, we love to party together. We can't take out this from our community.
That's what it is.
No way. So we also love to go play soccer, do gyms together. Those kind of stuff help people well-being.
Yes.
Definitely.
You enjoy together. You go for a walk, because you know when we talk about the 5 elements like the fire, the water, the earth, those kind of stuff. If you notice that back to Cote d'Ivoire or Burkina Faso or Africa, we have trees, we have forests, we have sun, we have everything. So we feel less those kind of mental health than here. Here we don't have that. Winter start. No more sun, you have to be in. But why you still need the sun, you still need the air.
And the trees around us.
The trees,
Yeah.
So, this is how, and we try to work together, we go to play together, we enjoy together, we eat together. So, and if we don't have that, for sure, we will have some kind of impact.
What's your thought there, Day?
Yeah, that, as you said, it's more like a social and cultural interaction with people. That's how we are helping ourselves, losing a bit the pressure of life, living in Canada, because it's a different kind of life, it's a different way of life. We get used to it. For me, I don't know if I will ever get used to it, because I'm learning every single day new things. But I mean, to overcome the stress, talking about mental health, is the social interaction, the cultural interaction, trying to recreate a bit of what we lived back home and share it with our children to just transmit that joy, transmit those emotions, loving where you are coming from, or loving yourself, usually before COVID. But as I said a bit earlier, it's been very challenging with the COVID and the restrictions. It's been very, very challenging for families. Thank God we have the vaccine now, and people are step by step getting vaccinated, and the government is putting down protocols for people to get together again, because the government knows it's very important for our health situations. But, well, that's a bit how we get to go through the stress and the emotional challenges that we could face in communities. But as I said, it's activities, it's getting together, sharing good news, and yeah, that's pretty much the way we live, and trying to recreate that here in Canada.
Yes, sometimes people go to smile, and we don't know whether we are smiling. In simple terms, you know. But if we miss those things, that means we are pretty sure we don't have the wellness. And just think about yesterday I drink water or something, or I enjoyed something. I don't get the same feeling and happiness today when I'm doing the same. So that means we have something happen to my own mental health. So even it is simple thing that might be some of the symptoms of our mental health issues. It's not being discussed inside the family, not outside of family as well. So that when we think about wellness and mental health, especially when we live in Canada here, and just try to connect with the people and culture, community, as you said, you know, what we know, what is the best way to make me happy, make my family happy, and what is the challenges there in front of that to not attain those. So we know all those things, and the better way, we know the solutions at this time. Because I know that the government is providing lots of support, but we are not able to attain all the levels of health.
Yes, that's what we need.
So that means in between. So that means it's really good, Shweta. We need to talk more openly about this one, because this is, if anything happens to me, this time it's only affect me. But when we think about in broad sense, tomorrow it can happen to another family. It's you, next family in their cultural community. That's what's happening around our culture. People who move from one place to another, especially here. So that's one of the meaning of this discussion that we are bringing out.
Definitely, to add to what you just said, is like maybe today it's me, but due to the fact that we are all exposed to the same condition and to the same situation in life. Of course, it may happen to you tomorrow, and then and now.
Sorry to cut you off there. Whenever you kind of think about mental health, it's 1 in 5, right? And there's how many of us today? 6 sitting at this table, right? And we need to realize it's not a them problem, it's an us problem, right? And we need to really talk about that. And whenever you kind of think about it, there's a fine balance between wellness and health, right? And that balance needs to be maintained. Like Gigi was talking about, being happy with ourselves internally and being happy with the people around us and our environment is very important. So what are those barriers, right? So job loss, like what we were talking about, COVID, not being restricted is another one, right? And there's so many different things that we need to kind of think about. So Ajay, sorry, I kind of cut you off there, and you were going to say something else there.
What do you want to say? Yeah, I wanted to say that before COVID, we used to share everything together, like in our community, friends. We used to go to the house to share everything, almost everything. So now with the COVID, it's like something has been pulled off, something has been removed by force, putting us at home by force, and that is very trigger for our family and our well-being. So I think something has to be done to our well-being. Like something has to be done to recover, to get back our happiness, our culture.
We all are talking about heart and relationship. We all are talking about the issues between the family members, between the community members, between the person work with in the community, or all is relating absolutely based on our heart.
Even those, now the new way to connect with others, it's not the same. Even we use the technology like a phone or video, we miss the natural connection. Like it's not the same virtual.
Yes.
It's not the same
I
virtual.
know, absolutely.
I agree with you. I totally get where you're going with this. So this was a great conversation, guys. I really enjoyed having this conversation, and I'm sad to say it's ending, but hopefully, we get the message out there that, we are all suffering with some mental health issues. It's 1 in 5, and we need to start talking about it openly. So thank you so much for coming and having this great conversation with me
Thank
today.
you, Acha.
Thank you for giving us the opportunity.
Thank you, Cassia. Thank you so much.
So Gigi, today we had another community talking about mental health, and it was the community of Côte d'Ivoire and Burkina Faso. And one of the things that was highlighted was the cultural competency of healthcare providers, right? What's your thought about that?
That's a great information, and this is really new information for me as a mental health worker, That's really good for, we need to communicate with others. Yeah.
And I think the other thing is it's important to ask why is those questions being asked. So I'm hoping that people are going to ask more questions and be more open about their struggles, and that they seek help. Thank you.